We're now joined by Julienne Cherry, who is the Executive Director of Summit Health Cares, and also Dr. Hari Nadiminti, who is Chairman of Dermatology at Summit Health and a board member of Summit Health Cares. Thank you both for joining us.
Thank you for having us.
Thank you.
Cherry, put in perspective, what is Summit Health Cares?
Sure. Summit Health Cares, this is our rebranded name. We were actually founded as Summit Medical Group Foundation in 2013 as the charitable arm of Summit Medical Group. As you know, Summit Medical Group has changed their name to now Summit Health. We were built on the premise of everyone deserves access to health and to live a healthier life. So although we've changed our name, we're still providing care and transforming lives.
And Doctor, let me ask you, the primary focus of the foundation, and clearly Summit Health is one of the many healthcare organizations that support what we do in terms of healthcare programming and awareness. Dr. Nadiminti, the key elements, let's break this down, what your colleague said. What are the key areas that the foundation is focused on?
Thanks for bringing attention to us. Our main priorities and of the foundation are to provide healthcare to all of our communities. Not with Summit at Summit Health, we provide healthcare to our local communities, and with Summit Health Cares, we try and provide healthcare to the communities that we don't reach through Summit Health. And Julienne can speak a little bit more about that piece.
Yeah, so we're built on 4 pillars. Our first pillar is really just empowering our communities and removing barriers to access to care. And that's basically through our health and wellness screening, boots on the ground with our mobile unit, working alongside of those in our underserved communities that need access to care. So those are with chronic disease. And our second pillar is providing comfort to cancer patients, providing them that social and emotional support as they're grappling and going through chemo, really trying to increase their chances of survival. And then our third pillar is educating future leaders by really providing a clear path for our career in health. And then our fourth pillar is giving back through financial assistance. So that would be either through our, helping one of our team members, a patient in need, one of our current community partners, or even providing scholarships. This past year, we gave out over $30,000 in scholarships to anyone pursuing a degree in health, living in New York, New Jersey, and Oregon.
Got it. Doctor, let me ask you this. The Sun Safety Awareness Program, as a dermatologist, as a chairman of dermatology, you understand this better than most. What is that initiative and why is it so important, particularly to some of us who worship the sun just a little too much?
Yeah, it's an important initiative, and it was named in honor of Joseph Enright, who was a physician here. He was an internist that unfortunately died of melanoma at a young age in his late 30s in 1996. And in his honor, we try and bring awareness to the importance of sun safety in New Jersey. As a dermatologist, I'm surprised at the amount of skin cancer I see here. I grew up in Florida, and we saw a lot of skin cancer there, and I'm quite surprised at the amount of skin cancer and the sunburn we see here. So it's important to bring that awareness to New Jersey and to our patients and to the entire community. And skin cancer can affect all of us, and the main thing is sun safety. And we've created a course, the Enright Sun Safety course, where we can educate our community through these online courses to really get them aware and of sun safety and what to do to protect themselves.
Let me push back a little bit in a good way, I hope. I have deluded myself for years that because our family's from Italy and southern Italy, and it's a certain kind of culture with a certain background in our skin, we want to believe is olive. We like using the word olive. I don't even know what that means. That I'm less susceptible than people who are much fairer, if you will. Delusional, no?
Yes, there's some truth to that, but there's also some
not enough truth to it.
Some myth. Sun safety is important for all of us because skin cancer can affect all of us. It is more common in fair-skinned individuals, but
any one of us is susceptible.
Absolutely, anybody is susceptible to skin cancer. And just today, I saw about 10 people with skin cancer of all different ethnicities and races. So it's important to see that and to recognize that. And I'm glad you brought that up. It can affect all of us, no matter our skin type.
Yeah, and by the way, go on the website that we put up there for folks to find out more about sun safety and taking care of your skin. Julienne, I need to follow up on this.
Sure.
Vaccine resistance, hesitancy, disproportionately, well, it's in a lot of communities, but it's also in the African-American community, people who are Black and brown Americans. It's very real. It's real across the board, but particularly a problem there. What are you and your colleagues doing to confront it directly and help people understand what they need to understand?
So during COVID, our team was still boots on the ground. We were still providing access to chronic disease through our diabetes initiative, but we quickly pivoted to address the needs of the community. We quickly began to provide education to dispel the myths and providing, alongside of our Summit Health physicians, really helping our community understand the facts of what the vaccine is. We also started doing testing. First ever, we didn't know, we were always doing chronic disease. So now we're doing access to vaccine testing, chronic disease, providing education, showing them how to properly wear a mask. That was a big challenge for our neighbors in need. As they were approaching our mobile unit, their masks were at their chin, and we would say, put it up. We have to keep yourself safe. And then
It's
also
all the way around. It's not over here. It's not a chin strap. Go ahead, I'm sorry.
That was crucial, providing that level of education, providing that PPE, providing the hand sanitizer, and showing them how to actually use it.
That's right. And by the way, Doc, let me follow up with you. You were a key member of the team that did the COVID-19 Vaccine Hesitancy Study. Give me 2 or 3 key findings, please.
So the important thing is the vaccine was rolled out and it was really taken upon the community. A lot of the community really wanted it, but a lot of people were quite hesitant to do that. And I'm proud of the work we did to really not only bring access, but also to understand our community better. Over the last almost 10 years, we've become a trusted partner in the community. And as a result, we were able to first find out what our hesitancy issues were locally and really help educate and really get out there, like Julienne said, boots on the ground, to offer testing and vaccination and education, because we're all in this together, and it's important. The main thing here is trust and trusting each other. And I really am proud of the work we've done and hope to continue this work.
And Pete, sorry for interrupting. As we wrap up this segment, the other part of the problem is obvious, and you don't need me to tell you, and it's not my opinion. Much of the problem is about information, misinformation that comes from a lot of sources that are not medical, that are not science-driven. And what we're trying to do is put out folks who are credible, who don't have a point of view, but are offering important medical, health, and scientific information. Then you go from there. I'm off my soapbox. Julienne, thank you. Doctor, thank you so much. We wish you all the best.
Thank you, Steve.
Thanks so much.
You got it. I'm Steve Adubato. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by PSC&G, Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Economic Development Authority, the New Jersey Board of Public Utilities Clean Energy Program, Johnson & Johnson, the Robert Wood Johnson Foundation, the New Jersey Education Association, University Hospital, and by Caldwell University. Promotional support provided by Insider NJ and by NJBIZ.
Every day, nearly 2 million customers across New Jersey rely on PSC&G to provide natural gas. And every day, PSC&G is committed to doing it safely. That includes making sure you know what to do if you smell gas. A natural gas leak smells like rotten eggs. If you suspect a gas leak, leave your home immediately. Get far away, then call 911. Remember, smell, leave, call. Protect the ones you love. Learn more at pscg.com/gas safety.